Hello, my name is Dr. Dan Buchanan, and I'm going to give a brief overview of our program. We are often asked at UniqueU how we help patients with weight loss, and our orientations to our program can last up to an hour, so my purpose is to condense this into about a 5-minute overview with the most common questions that we get. First of all, at UniqueU, we have a very individualized program. We help patients lose as little as 15 pounds up to over 200 pounds. We also treat patients with multiple health conditions, type 2 diabetes, hypertension, just to name a few. So I always emphasize that this is a very individual-based program, but we do use a lot of the same supplements, medicines, and we also have broken down our program into a 4-phase program to help patients focus on regaining their health, losing fat, keeping muscle, and why that is so important is from a medical perspective that will increase metabolism, which then will make maintenance easier. As I mentioned, we have 4 phases in our program. We begin with a detoxification phase. We begin with a lot of diagnostic tests that usually include labs, a brief physical. We take everyone's history. Occasionally we do an EKG. That will ensure that everything that we use in our program is medically compatible with our patients. We then go into our phase 2, which is a phase where we introduce several supplements and a few medicines determined by our medical staff. And the purpose of that phase is to help promote the burning of stored fat. We then move to phase 3, where we completely change up diet, supplements, and the purpose of that phase is to burn normal fat reserves. So again, our focus is to help promote the burning of fat, keep muscle, which will increase metabolism. Once a patient reaches their goal, we go to phase 4, which is maintenance. In our opinion, this is where many weight loss programs fall short. We use a core metabolic test to determine proper calories for each individual patient based off their metabolism to maintain all of their achievements. And it's that maintenance phase that is really the rest of our patients' lives. It lasts 2 weeks with our practice, but the emphasis is on the rest of our patients' lives. Our patients' success is our success, and we want our patients to do very, very well. I'm now going to go over the most common questions we get at UniqueU. The most common question is, how much does our program cost? Our program averages $100 a week. Our payments are broken down by phase. So back to the individual specific component, the amount of phases someone does is dependent on their individual weight loss goal. And I will get to that question in a minute or two as well. But our program averages $100 a week. Most patients do a 14-week program. As mentioned, the fee schedule is broken down by phase. I am often asked if we take insurance. Most commercial health insurance policies don't cover medically assisted weight loss programs. However, patients with health savings accounts, flexible spending accounts, many patients use those at UniqueU to pay for their program. We also are affiliated with multiple healthcare financing companies. Our program is financeable, which can help spread payments up to over a year. Our purpose is to help as many patients as we can, and we don't want money to get in the way of a patient's health, so we do offer financing at UniqueU. The second most common question we get is, how long does our program take? As I mentioned in the beginning, we treat patients who want to lose as little as 15 pounds up to over 200 pounds. So needless to say, the individual's weight loss goal is a big determining factor of length of time. But a common example that we see at UniQU is a patient who might want to lose 25 to 30 pounds. And we can often predict amount of time by using a 2% body weight loss equation. An example of that is if a patient weighed 200 pounds at the beginning of their program, 2% of 200 is 4. So we would be looking for about 4 pounds of weight loss a week in the beginning of their program. But because it's based on a percent, the less they weigh each week, just by a fraction, the less we would expect them to lose. But if a patient weighed 150 pounds, 2% of 150 is 3. So that is a good mental way to determine an estimated length of time if we know beginning weight and goal and use a 2% body weight loss per week formula. That can tell us about how long it will take a patient to meet their goal. The third most common question we get at UniQU is side effects. What are the side effects to the medicines that we use? Well, our medical staff will do a complete history and physical on patients, and as mentioned in the beginning, a complete battery of tests, and our medical staff can review with patients the potential side effects of medicines. But there are very, very few side effects to the medicines that we use with the vast majority of our patients. And weight loss is one of the healthiest things a patient can do. Weight loss can help reverse or prevent very chronic diseases such as type 2 diabetes, heart disease. With weight loss, oftentimes knee and low back pain improves or even goes away because of the amount of pressure on our joints is not nearly as much. And in ending, I would like to say that we have helped thousands of patients reach their weight loss goal. We are always available for complimentary consultations on our program, but the purpose of this brief review was to give potential patients an overview of what we do. If you're comparing our program to others, I ask you to please look at what other programs are giving you for the cost. We include multiple supplements, testing, we include 4 different phase diets, weekly visits with our staff. We have 3 different levels of support. Of course, the phone is our primary level of support, office visits, as well as internet. So we have found that the multi-phase program, based off of an individual specific goal with the different levels of support, are really the best way to help patients. If we can keep patients not hungry, high energy, with consistent, measurable weight loss weekly, patients will get to their goal. Thank you for listening.